Welcome, everyone. Again, I'm Natasha Bonham with Expecting Health, and we are so happy that you're here to join us on this particularly special webinar where we will be talking with our 2023 Newborn Screening Grace Award winners. As a reminder, we are recording, and if you have questions, you can feel free to put them in the chat box, and we will be sure to respond to them. Next slide, please. I think we've covered those, so wonderful. Oh, and also the recording of this webinar will be available on our YouTube channel in the upcoming weeks. Next slide. So before we speak with our award winner, a little bit about the Grace Award itself. We started this award about 3 years ago, and it is the Generating Real Action by Cultivating Engagement Award. And it really is a first of its kind award that is meant to focus and recognize the authentic and graceful team approach to family and community engagement in newborn screening. And the reason why we really picked those words and those attributes is sometimes with awards, you are really encouraged to highlight all of the good things, all of the positive things that happened in a program. And while that may be great, we know that we get so much out of learning. And so, really, that idea of grace and that idea of we're all starting in different places and we all have a lot to learn and can share with each other is really core at the center of the Grace Awards. And so our small committee who reviews the applications really looks to see how much of that part of the story is shared in the application. So we love to see all the successes, but that group really also looks for places of learning and how a group may move differently, act differently, and put something different in place because of that learned experience through working with families, engaging communities, and really seeing where there could be improvements on their part. And so with that, we can go to our next slide. And I'm so happy to share that our award winner this year was SCID Compass. The Immune Deficiency Foundation's SCID Compass program embraces family engagement from development to implementation to ensure that families and caregivers have the information and resources they need while navigating a SCID diagnosis. And it was really great to be able to read this application and to be able to see all of the work that this group has done. And so I will now pass it along to Alissa Creamer, the Senior Director of Education and Community Services at the Immune Deficiency Foundation.
All right, thank you, Natasha. Give me a minute. Let's see. Can you see my slides, Natasha and Dr. Ebony? Yes, great. All right, I will get started. So thank you, everyone. As Natasha mentioned, my name is Alissa Creamer, and I'm the Senior Director of Education and Community Services at the Immune Deficiency Foundation. And it is really such an honor to be here to accept the 2023 Baby's First Test Grace Award and share more about our program, SCID Compass, as well as the Immune Deficiency Foundation. So I know that many of you tuning in today are doing so because you're an individual, a parent, a caregiver, or a friend to someone living with severe combined immunodeficiency or SCID. I recognize a few of the names who are participating today. But I also know that many of you joining might work in newborn screening, and depending on what state you work in, you might be the first person to tell a new parent that their newborn may have SCID. So no matter where you fall along the SCID journey, your role is important, and I'm really glad you're here to kind of learn about this program and be able to support others along their way. So SCID Compass is an educational program of the Immune Deficiency Foundation and was designed to guide parents of infants diagnosed with SCID, people living with SCID, and the medical community through the journey of learning about this rare, life-threatening medical condition and finding support to navigate the challenges along the way. So this project started in late 2018 before all states were screening for SCID, but the end was definitely in sight. In over 5 years, we launched surveys and studies and created many resources for those navigating a SCID diagnosis. So SCID Compass was supported by a grant through the Health Resources and Services Administration, or HRSA, which is an agency of the U.S. Department of Health and Human Services. SCID Compass was also developed through a partnership between IDF, RTI International, and the Association of Public Health Laboratories, with support from the team here at Expecting Health, the SCID Angels for Life Foundation, and the Primary Immune Deficiency Treatment Consortium. This very dedicated group of individuals met every other week for 4 years to really build this program. And we have been privileged to have some individuals who are with us from the very beginning and others who only joined us in our final year. But truly, every single person brought tremendous experience, insight, and passion to this project, which I'm going to talk about for the next little while. So I would also really like to extend a heartfelt thank you to the 15 parents, adult patients, and professionals who served on our steering committee and parent-patient advisory board. They provided our team with much needed guidance and personal experience as we built this program. The names of parents or patients are in italics on your screen. Also, a generous thank you to Dr. Jack Rudis at the Medical College of Wisconsin, who served as our medical director for this program and ensured that everything we created was medically accurate and appropriate. And finally, a huge thank you. And the reason why I'm here today is just a thank you to all of the parents who shared their time and their stories with our team, whether it was completing one of our many surveys, and there were many, participating in a focus group, user testing our resources, or being interviewed for a blog post or a video. This program would not be what it is without parents and families taking time out of their very busy lives to share their journeys with SCID. One of the biggest needs that we identified at the start of this program was to highlight stories of real families who've received a SCID diagnosis. And that really wouldn't be possible without having actual parents willing to share their stories with us. And I really wish I had a photo montage so I could share the images of every single family who opened their lives up to us. There was good, there was bad, there was stressful, there was inspiring. We are really indebted to each and every one of them. And to Heather Smith of SCID Angels for Life, who was really the one that connected us with so many of those incredible and outstanding parents. So a huge thank you to all of them. I want to make sure they get just as much credit for how amazing this program is. So while our grant in the world changed significantly since we were first awarded in summer 2018, I wanted to at least share and kind of level set what the original purpose of this program was. So our charge from HRSA was to increase awareness and knowledge of SCID, support state newborn screening programs, link families with children with SCID to clinical setters with experience in treatment and management, and develop strategies for long-term follow-up. We were driven to be data-driven with our work in order to create a program that would fulfill the actual needs of those navigating SCID. So we started off this program distributing several surveys and conducting many interviews with parents in order to kind of guide our work and the direction we needed to go in. So on your screen are just some snapshots of just 3 of our data collection methods, some for parents, some for providers, and some for newborn screening programs. I assure you there were many more that can't all be shown on this slide, but this is really kind of where we started to figure out how we were going to design the next couple years of this program. And from those surveys, we identified needs for both parents and caregivers as well as providers, from understanding available treatment options to understanding the different types of SCID to reading stories of real families and coping with uncertainty. These reported needs drove the creation of everything that I'm about to show you all. And we started with identifying a general SCID journey, which was based on interviews with a variety of parents of children who have children with SCID. So the journey map you see on your screen served as a basis for our website design, the resources needed at various points, and then an animated video series as well. And you can see the 5 kind of steps to a SCID family's journey, from diagnosis to pre-treatment, treatment, post-treatment, and the new normal, and kind of all the emotions, challenges, and pain points, the things that made a difference, and the information needs. And this was pulled all from interviews with parents who had navigated this journey before. So while we were identifying the needs of parents and healthcare professionals, the Association of Public Health Laboratories, or APHL, was also hard at work supporting state-level newborn screening programs. So as mentioned a little earlier, when we were awarded this grant and started on this programmatic journey, not all states were screening for SCID, and some had only recently started to implement screening. So APHL conducted a needs assessment survey and an RFP process to determine the level of support and needs that state programs were going to require from APHL to support this new screening process, because SCID was different than some of the other conditions on the RUSP. So throughout the grant, APHL provided funding and technical assistance to support many states in their implementation of SCID newborn screening, particularly. So support took many forms. Some of them needed equipment in order to implement screening. Some needed just some instrumentation upgrades. There were others that required some maintenance. And there was also a lot of training provided to the newborn screening laboratory individuals to ensure that quick testing for families was happening across the US. APHL also undertook a study to assess and make recommendations for screening premature infants to make sure that these preemie babies weren't getting stuck too many times or getting false positives or even false negatives. So they also recently shared some of their findings during a SCID Compass lunch and learn. So if you're interested in hearing about the information that they gleaned from that study, I encourage you to find our recording on scidcompass.org. All right, so when we set out to do our work, we knew that a website would be a really key component, and that we'd need to design just a place to direct people to learn anything and everything about SCID. So what you're seeing on the screen didn't exist until December 2019. Prior to SCID Compass, information about SCID was really scattered all over the internet. So we knew we wanted a programmatic website that had a breadth of information, news, and stories about SCID in one place. Um, so this website is a one-stop shop for really anyone interested in learning more around navigating a SCID diagnosis. So it's www.scidcompass.org, and it offers information for every step of the SCID journey, from newborn screening and diagnosis to SCID types, treatments, tips on how to advocate for your child, caring for your mental health, the latest SCID news. We also know that we are not the expert in everything, so we also link out to so many great organizations with resources that provide additional information on SCID, like NBSTRN, the team here at Expecting Health, APHL's New Steps program. So if you haven't been to our website at all or in a while, I encourage you to kind of go and click around and explore. There's lots of different avenues and directions you can kind of fall down. The website itself is also available in 5 languages other than English. So that is Spanish, French, German, Portuguese, and Tagalog. And you can access those by selecting a language on the upper navigation. In addition to the 5 languages the website is available in, we also have a SCID Compass toolkit, which is a condensed and downloadable and printable version of the website, and that is available in 12 languages. So English, Spanish, French, Portuguese, German, Simple Mandarin, Tagalog, Hebrew, Korean, Vietnamese, Dina Bazad, which is the language of the Navajo Nation, which is impacted by SCID more than other cultures, and Arabic. So these languages account for some of the most common languages spoken in the US, because we know that not every parent who has a child that's born or treated for SCID in the US speaks English proficiently. So we wanted to have a resource available to anybody navigating this condition. So it's 12 languages, which is a lot. We know there are plenty more languages out in the US, but we hope that somebody can find one of these versions and it be supportive for them. It also wouldn't be a very good educational program if we didn't offer information that really starts at the beginning of a SCID journey and providing information and education about newborn screening. how to interpret results, offering kind of a little history about newborn screening and newborn screening for SCID. And this page in particular is usually one of the top 5 most visited pages on the SCID Compass website each month, showing that many individuals might get that call or that notification saying that their child has an abnormal screen for SCID, and parents are turning to the internet to learn more about what that means and then finding us. Um, Many parents don't need to go any further on our website after this if they find they do confirmatory testing and if they find they have some other condition. But we're happy to know that people come here as a good starting landing page. So to get factually correct information to parents and providers in those early days between that screening and that confirmatory testing, the team at RTI created 2 newborn screening fact sheets. One is for parents, one is for providers, and these are meant to provide quick information about SCID and then direct individuals to resources like IDF or SCID Compass program, as well as SCID Angels for Life. I'm also thrilled to share that many states' newborn screening follow-up programs share these documents with their abnormal screens. They are free and downloadable on our website and can be customized with your program's contact information. So if you want to start distributing this resource to your parents or providers, you can email me and I'm happy to get the PDF to you directly. We also heard from many providers and many parents that it's just not enough to provide information on SCID, but what about all the details and the decisions and the information that come along with an abnormal screen or a confirmed diagnosis? So examples like, how do you cope with isolation? How do you prepare for life at home post-treatment? How do you pay for all of these treatments or these hospital stays? Many people also think about the impact on having future children. So we have lots of those topics covered on our support and resources page. It offers a breadth of information about navigating the kind of non-medical aspects of SCID that probably keep many parents up at night, in addition to the treatment decisions for their children. The best part about this information is that it's applicable to really anybody navigating a hospital stay or a complex diagnosis. So maybe you found us because your child received an abnormal screen for SCID, but confirmatory testing leads to another diagnosis such as congenital athymia. Many parents will still benefit from these additional resources. Another very highly requested and very popular webpage is our SCID treatment and types overview. And here we provide in-depth information about the over 13 types of SCID and the 3 most common treatments for SCID based on the type of SCID that you have. It's not enough that an infant is diagnosed with SCID, but to learn that there are varying types that influence the treatment plan can be even more confusing for parents. So further, children who undergo pre-treatment conditioning prior to a hematopoietic stem cell transplantation, that can be a very confusing process for parents to understand. So we learned that from parents that this treatment decision can be confusing. So we created kind of a web page that walks you through if then questions to consider and to bring up to your provider, if this is an option that is presented to you. So like the newborn screening page, the web pages on SCID types and treatments are some of the most popular each and every month. And then here's just a glimpse at some of the resources we created, again, from all of those surveys from parents and providers. One of the ones highlighted on this page is our family planning resource guide, which grew out of conversation with parents who already had one child with SCID and wondered about kind of what the future held for them to have additional children. And again, all of these are available and downloadable in our printable toolkit and available in 12 languages. All right, so we know that a SCID diagnosis is not one that just impacts an infant, but it really impacts an entire family. We have resources that help parents navigate this diagnosis as a family. So our animated SCID Journey series follows a fictional family through a SCID diagnosis from birth to school aged, and it's also available in Spanish. We also have a podcast about supporting siblings of children with chronic illnesses. And we've also shared many stories from parent perspectives, including a panel of SCID carriers and how they navigate growing their families, knowing that they're SCID genetic carriers. There are plenty of opportunities to learn and support for whatever your kind of needs may be for you and your family. So if you want to hear about one family's experience at a certain point in the journey, such as diagnosis, navigating a hospital stay, or entering a new normal, we have a Q&A series with a few families who do just that. You can hear from the Dugans, the Billy Georges, the Hargroves, and the Woos about their just unique experiences navigating SCID with their families. This is also just a snippet of the I think at this point it's more than 15 parents and adults with SCID that we have highlighted through videos and long form stories, and those are all on our website. And because we live in an increasingly digital world, the majority of our programming is provided in a variety of formats to suit the needs of SCID and PI communities. We offer programs in a live webinar format, podcasts, news and blog updates. We have had 7 SCID-related podcasts hosted on IDF's own podcast. Our SCID-themed ones have been streamed over 4,000 times, which is phenomenal. So no matter how you like to learn or take in information, we offer programming really in a format that suits your needs. And I don't know if I've mentioned this before, but all of our programming is free for anybody to access. As I mentioned earlier, again, all the decisions made in this program have been very data driven, and we've shared that data so far in the form of 3 peer-reviewed manuscripts in Frontiers in Immunology as well as Frontiers in Pediatrics. In the next couple of months, we expect to have a few more manuscripts published on our work and the findings and some lessons learned. So we know that news about SCID is also nonstop, and we work really hard to publish regular blog and news updates highlighting what's going on in the SCID sphere. We also offer free webinars for the SCID and IDF community. These are generally 60-minute presentations on topical information and are provided by experts in the field, and participants can ask questions in real time. So we've covered so many topics, everything from newborn screening lab processes in North Carolina to transitioning from pediatric to adult care. We've asked the question, what is the PIDTC, and really everything in between. Our next SCID Lunch and Learn is in October, and it's on providing updates on ADA SCID gene therapy with Dr. Donald Cohn. We also offer webinars for other diagnoses within the PI umbrella. So we've covered WHIM syndrome, hyper-IgM, Wiskott-Aldrich, and chronic granulomatous disease. Our next diagnosis-specific Lunch and Learn is on X-linked A-gamma globulinemia, and that's on October 11th. We also offer plenty of opportunities for connection and support for individuals with SCID, but really anybody with any type of PI. We offer a virtual caregiver group, which is a monthly support group for caregivers to people with PI, and that includes SCID. This group is facilitated by a licensed mental health professional and helps guide conversations around being a spouse or a caregiver to those with life-threatening chronic conditions. But we also offer volunteer-led Get Connected groups, which are offered virtually all over the US. These include a twice monthly parent Get Connected group, one which is actually led by a parent of, he's now a young adult with SCID. These are great opportunities to meet other parents with young kids who have all types of PI. And I also want to share that SCID Angels for Life Foundation is another incredible resource for parents of children with SCID. And you can find SCID Angels on the web as well. Through the grant, we also sponsored 2 studies. PIDTC completed a neurodevelopmental outcomes study. So they were looking at the outcomes of children with SCID who underwent pre-treatment conditioning and were understanding some of the neurodevelopmental outcomes that come from having conditioning so early in your lifetime. So they are working on compiling some of their data, and we'll share that in the future. And then Dr. Yolan Walter also completed a study on SCID variants and Irish travelers, which is a small community scattered throughout the US who have additional needs as well related to SCID. All right, so it goes without saying that this program has made a huge impression on the SCID community. The website launched in December 2019, and now we are in September 2023. That's 5 years later. We have had over 200,000 unique web visitors. So that's really 200,000 people who were looking for information specifically about SCID, and they came to our website and found it. SCID is a rare disease. There's roughly 100 or so individuals who get diagnosed each year. So having 200,000 people who've come to find our program is very impressive. Um, as well, SCID Compass related news and social media posts on Instagram, Facebook, LinkedIn, and what was Twitter, but I guess now is called X, has made over 300,000 impressions on social media since 2018. So that's people who have liked, loved, viewed, or shared something related to SCID with their networks. So you can kind of see on the screen that there's a bunch of graphs about where people are finding us from. Many people are doing organic searches, and we aren't just US based. We get people from all over the world who are finding us. SCID is screened for in the US and quite a few countries throughout the world. So you can see some of the pockets where people are finding us and our resources, because we are also available in many, many languages. All right, so what's next? Where can you find us? So we are partners in a California SCID long-term follow-up project, which aims to develop education and support for families in the years after diagnosis and transplantation. We also continue to support the PI and SCID communities through educational opportunities. IDF knows the value in being able to connect with others with rare conditions, so we're really thrilled to return to an in-person signature event next year. Our PI conference will be in Chicago, Illinois in June 2024, and we hope to see you there. But other than that, just a huge thank you. We have been able to provide so much to the SCID community over the past 5 years and are really so honored to share it with you all today. Again, this project would not be possible without all of the amazing parents, caregivers, and professionals who provided their expertise and their knowledge to make this program as beneficial and amazing as it has been. So I am, again, so honored to be here, and I'm happy to answer any questions, but also encourage you to check out our program, skidcompass.org, so you can kind of see for yourself all of the amazing work that we have done.
Great. Thank you so much for that. Um, it really shows just how much work and effort went into that program. I wanted to note that the team that did the review of the applications for the Grace Awards, no one on that team was part of the Expecting Health team. We staffed the award, but we have a group of others who look at the applications, review them, score them, and all of that, so that there isn't any conflict of interest there. So I wanted to put that out there. And now, please feel free to submit any questions that you may have in the chat. And I believe that we had one about where to find the lunch and learns, and those can be found at the link that was posted there, primary.org//events. And then one question that we had is really, this is such a great project with lots of different components. And what advice would you give other programs and groups who want to really effectively engage families and patients, but aren't really sure exactly where to begin?
And I think that's a great question. And I think from our perspective, it came from HRSA that family involvement was important, but also from an IDF perspective and being a patient advocacy organization, we knew that engaging families was a priority. And we knew that it would be challenging as well. SCID is a rare condition. Um, if you have an infant with SCID, you can be really in the thick of it for some time, but we knew that it was important and it was a priority. So we really tried to find some really strong voices to kind of help us make it a priority. And Heather Smith and Barb Ballard at SCID Angels for Life were some tremendous partners in this effort. They were on our direct team and could provide the team that met every 2 weeks with some information and feedback, but they were also just amazing with connecting us with families. So it's hard, but if you find some really great champions and include them from the outset, and make it a priority, um, I think that's my biggest advice. Is it's tough, but if it's important to you, you will really find a way.
Great. You mentioned two things in that
Hmm.
comment that I want to follow up on.
Hmm.
One, that this was a HRSA
Hmm.
funded program, and that you are, IDF is a patient organization. And so, could you speak a little bit about how the type of patient engagement work that you have done
Hmm.
historically as an organization, how that either compared or contrasts to what was needed under a federal program?
Hmm. So this project was entirely new to IDF. We had never undertaken something of this magnitude before, um, especially something that was targeted at education for parents and caregivers. Yes, there were components that were directed towards providers, but this was really our first big patient-focused project. And we felt like in reading the NOFO from HRSA that it was something that we could really take on, given our skill set. But it still was challenging to figure out, okay, yes, we know patients, navigating PI, but how do we pull in other partners that have more expertise than we do, like the APHL, who knew about all of the newborn screening and the lab processes, the team at Expecting Health, who also knew about supporting parents through the newborn screening process, the team at RTI International that really helped us be data focused and data driven. I think IDF knew that from a patient perspective and a PI perspective that we could take this on, but again, it was finding other individuals who know much more than we do to kind of help us build a program and then guide our work. But it was certainly a big undertaking, and we definitely learned a lot. We had past grants, but those were through NIH, and those were more for provider folk. It was a data registry, so it was working with providers. But this was our first big patient undertaking, and I think we did all right.
Yeah, absolutely. A question that just came in, could you elaborate a bit on any of your efforts to try and measure the impact of some of your educational activities?
Hmm.
How are you doing that, and what have you learned from it? And we know that that's something that can be so challenging because you want to see, so often we're asked, well, what's the outcome
Hmm.
from this educational activity? And it can be really hard to connect the dots. So anything that you have on that would be great.
Yeah, so this is a great question because before this program, nothing existed. So we tried to pull data to understand, like some baseline data to show HRSA what was going on in the SCID space before, and then create some activities and some educational programs. But it's really hard to compare apples to oranges when things are very different. But as we kind of built this program, we tried to figure out what the impact was by how many unique visitors are coming to this website. Every month? What is the amount of time that they're spending there? What kind of documents are being downloaded? Who is attending our and registering for our events? Who is attending? Kind of what is their relation to SCID? Is this parents? Is this a newborn screening professional? So we tried to pull data as much from all the different places that we could to figure out who keeps returning, how many people are we reaching. You saw some of those numbers of the impressions on social media and the unique visitors to our website. So we feel like those numbers kind of point to and show that people are finding us and spending X amount of time and then sharing it with others, as some of those social media numbers propose. So it's easy to do that when we have a lot of virtual programming and can kind of glean data from that. Um, Google Analytics does a lot of amazing things, and so does our database that we collect information in. But I think that's kind of some of the components of it, is just measuring, like, or keeping track of who's showing up and who's going to our website. And we can, if you click on a Facebook link, we can figure out where you went next. There's lots of if then scenarios that my friends in our communications and marketing team know much more about than I do.
Great. No, I think that's really, really helpful. And one last question
Mhm.
for me
Mhm.
is, as you now are in the process of closing out the federal program, right?
Mhm.
The activities are going to go away. But how are you thinking of sustainability and just the next steps
Mhm.
in this work?
Yeah, so we kind of began this program with sustainability in mind, knowing that people are going to be diagnosed with SCID constantly. So we can't build a program and then run out of funding and have it go away. People are always going to need us. So we have always kept that in mind. So SCID Compass now exists as a program of IDF. We have worked it under our umbrella. We've had quite a few years of no cost extensions and working with HRSA to slowly pare down the program. So that way we could kind of plan for it. So it exists as part of some of our core programming. And we continue to provide regular lunch and learns and news updates for SCID just as we would any PI condition. So if there's news about SCID, we're going to make sure that the community knows about it. Our partnership with the Cal SCID long-term follow-up program also ensures that we're still offering some lunch and learns for the SCID community. So we're always, it's part of our core programming, and we're always looking for opportunities to continue to share the message with our community.
Great. Now that's really, really good to hear. I'll see if there are any any questions. Any kind of closing words or parting words from you?
Just, I'm truly so honored to accept this award on behalf of literally the entire team. I shared a slide with everybody that was involved. So I know I'm here and kind of speaking on behalf of everyone. I was really just the one behind the scenes, coordinating all the meetings, doing all the emails. It was really everybody else who did all of the work and really shared their story. So I'm here to accept it on behalf of all of them, but know that I played a what feels like a small role. It was really the parents and the professionals who gave so much time and effort and expertise. And I do know that members from other teams, I know APHL and RTI, have all said how much working on this program impacted them. They really saw that providing a program and providing resources for parents is so important and makes such a difference. Sometimes I feel like it's easy to say, oh, we're going to design a program and do this and that. But if you don't really think about who it's designed for and who really needs it, then what's the point of your program? So just every parent who provided feedback, all the honesty, all of their stories, we truly are indebted to them. I feel like I keep saying it over and over again, but we would not, IDF wouldn't exist, SCID Compass wouldn't exist without all of those wonderful parents. And I do know some of them are definitely tuned in today. I recognize some of the names from over the years. So I think that's just my parting words is just thank you, thank you, thank you. But um, everybody else who is on that list deserves all the credit for it.
Well, thank you. And the emails and the logistics are what keeps programs going too. So please do not downplay all of your efforts. It was great working with you on that program and really the ability to learn a lot. And I think especially when we think of newborn screening, even though we say it's a system, we know that so much attention goes to the test. And it was
Mhm,
so good to have a program that really was focused on the family's experience,
mhm,
both before, during, and after, including, what happens next when you are thinking of
mhm,
expanding your family or what have you when you go through that newborn
mhm,
screening experience. So this is a program that I think really showed the importance of a holistic approach to doing work in newborn screening because we were able to do so much in terms of really following that family journey,
mhm,
not the test journey, not pre-analytical and analytical, but
mhm.
really the family's journey, their words through that. So thank you for all of your efforts in that. And now for our audience, you can see that we have a QR code up and there's also a link to our evaluation. Please fill this out. We really do look at, I was looking at the data just yesterday, so we do look at it and it really helps inform, what we talk about as well as how we talk about it for our community. So we would really appreciate for you to just take a few minutes to fill that out. Um, And we will also be sharing this recording in a few weeks, as I mentioned earlier. And with that, thank you, everyone. Thank you, Alissa, for presenting. And again, congratulations on being our 2023 award recipient for the Grace Awards. And we wish everyone a really wonderful rest of the day. Thank you.